So what's actually going on inside your body? Imagine your lung. Now, between the lung itself and your chest wall, there's this super thin little area. If air somehow leaks into that space, it gets trapped, and that trapped air starts to build up pressure, pushing against the outside of your lung and making it so it can't expand properly, and that's what causes it to collapse, either a little bit or all the way.
And this is exactly why we're digging into this. While some cases might be minor, others can absolutely be life-threatening. A collapsed lung is not something you can just, wait and see about. It demands immediate medical help.
Okay, so this brings up the most important question, right? Knowing the warning signs can make all the difference. Let's break down exactly what your body might be trying to tell you.
The signs are usually pretty hard to miss. We're not talking about a dull ache. It's typically a sudden sharp pain in your chest, usually just on one side. And it comes with that awful feeling of not being able to get enough air. Your body kind of goes into panic mode. Your heart starts racing, your breathing gets fast. And that bluish tint on your skin or lips, that is a major red flag that you're not getting enough oxygen.
The takeaway here couldn't be clearer. This is not a let me call my doctor in the morning kind of situation. If you're feeling these things, especially that combo of sudden chest pain and shortness of breath, you need to treat it like the emergency it could be.
Now that we know what to look out for, let's play detective and get into the why. What in the world causes a lung to just collapse? Well, it turns out there are a few different culprits.
We can basically split them into two big buckets, spontaneous and traumatic. A spontaneous pneumothorax is the kind that happens seemingly out of the blue, with no injury at all. A traumatic one, just like it sounds, is caused by some kind of physical injury or event. Let's break those down a little more.
So even within those out-of-nowhere collapses, there are two flavors. First, there's primary, which happens when these tiny little air blisters on the lung, they're called blebs, just pop. This can happen to perfectly healthy people. Then there's secondary, and this is when a pre-existing lung disease has already created weaker, bulging spots that can burst and leak air. Now, for the traumatic cases, the causes are a lot more obvious. An injury, right? A broken rib that pokes the lung is a classic example. But there's also something called an iatrogenic pneumothorax. That's a fancy term for when it happens by accident during a medical procedure, like a needle for a biopsy going just a little too far. So who's more likely to have this happen? Some of these risk factors make total sense, like smoking or having a known lung disease. But some are kind of surprising, right? Like just being tall and thin is a known risk factor, especially for men. And it makes sense that things involving big pressure changes, like scuba diving or even flying, can put you at a higher risk.
We've covered the what, the why, and the who. So let's turn to the most important part, the solution. How do doctors actually figure this out, and what do they do to fix it?
The diagnosis process is pretty methodical. It'll usually start with a doctor listening to your chest. They might hear that the breath sounds are really quiet or even gone on one side. But to be sure, they need to see it. A simple chest X-ray is often all it takes to spot the trapped air. For a closer look, they might use a CT scan or an ultrasound. And they might also do a blood test to check exactly how much oxygen is making it into your system.
Treatment usually follows a few steps, from the simplest to the most involved. If it's a really tiny collapse, the doctor might just say, let's watch and wait, and let your body absorb the air on its own. For a bigger collapse, they need to get that air out, either with a needle or by inserting a chest tube that lets air out but not back in. If this keeps happening, they might move on to more advanced stuff, like using a substance to basically glue the lung to the chest wall so it can't collapse again, or even surgery to fix the leak for good.
And you know that chest tube we just talked about? It's really important to know that it's not a quick in and out thing. It often has to stay in place for a few days. Its whole job is to keep the pressure off the lung, giving it the time and space it needs to slowly re-expand and heal itself.
All right, let's look down the road. What happens after you leave the hospital? Let's talk about recovery. And most importantly, how you can try to prevent this from ever happening again.
Our bodies are pretty amazing. In a lot of cases, once the immediate problem is dealt with, the body can finish the job. It'll reabsorb that leftover air, and the lung itself can heal up in about 1 to 2 weeks.
But, and this is a really important but, once you've had a collapsed lung, your risk of having another one does go up. A full recovery is definitely the goal and what usually happens, but you have to stay vigilant because it can happen again.
So what can you do? How can you get back in the driver's seat? Number one, by a long shot, if you smoke, you've got to stop. It's also really important to be careful with things like flying or scuba diving until your doctor gives you the all clear.
And of course, just keeping up with your doctor to manage any other lung issues is key.
At the end of the day, your recovery is a partnership between you and your whole healthcare team. The advice they give you about rest, about when you can get back to your normal life, that's not just a suggestion. It's your personal roadmap to a safe and full recovery.
So we'll leave you with this thought. This isn't just about knowing some interesting medical facts. It's about being prepared. Recognizing those key signs, that sudden chest pain, that shortness of breath, is step one. Knowing what to do in that moment and doing it without hesitation could really make all the difference.